Let us continue the treatment of the sexually transmitted infections. Now, the last infection is prostatitis. The prostatitis itself indicates the name of the drug, as you seen, the ST. So S indicates the sulfamethoxazole, and T indicates the trimethoprim. And we know that sulfamethoxazole and trimethoprim combination is known as cotrimoxazole. Prostatitis, ST, the prostatitis itself indicates the name of drug. S indicates the sulfamethoxazole, which is the category of the sulfonamides, and uh, which is antibacterial category, sulfonamides. And T for trimethoprim. The combination of the trimethoprim and sulfamethoxazole is termed as cotrimoxazole. So it should be uh, used in the concentration of 160 milligram trimethoprim and 800 milligram sulfamethoxazole 2 times a day. Let us see the cotrimoxazole here. What is the adverse effects? Generally, mechanism of action of this cotrimoxazole, it inhibits the bacterial synthesis of folic acid in the bacteria. Folic acid, and folic acid is an important constituent for the uh, synthesis of nucleic acid in the bacteria. So inhibition of the folic acid, there is no synthesis of the nucleic acid, and it kills the bacteria. Adverse effect of cotrimoxazole, QT prolongation, which is also known as Torsade D point. So uh, the great cautions should be taken while prescribing to this drug to the arrhythmia patients, thrombocytopenia, hypoglycemia, and this hypoglycemia and metabolic acidosis are interrelated, as you studied in the management of the diabetes mellitus. So hypoglycemia and metabolic acidosis. So person who is on the insulin therapy and oral hypoglycemic drug, the great precautions should be taken while prescribing cotrimoxazole. What is the contraindications? Hypersensitivity, megaloblastic anemia, because it causes the folic acid deficient anemia, megaloblastic anemia, because it inhibits the folic acid synthesis, hepatic impairment, and as we know that sulfonamides, this category of drug, sulfonamides and sulfamethoxazole is an example of sulfonamide. These are the drugs which are responsible for the hemolysis in the patient of glucose 6 phosphate dehydrogenase deficiency. So, in the persons of the G6PD deficiency, avoid sulfonamide drugs, which may lead to hemolysis. What is the category of the pregnancy? Cotrimoxazole. Because we know that during the first trimester of the pregnancy, the folic acid is very important for the neural tube development and the growth of the fetus. If this drug is given to the during the first trimesters of the pregnancy, may leads to congenital malformation, neural tube defect, cardiovascular abnormalities, urinary tract defect, oral cleft, and club foot. So it should be avoided in the mostly in the first trimester of the pregnancy, cotrimoxazole, and the penicillin G, which is the mainstay in the treatment of the syphilis. Adverse effect, as we know that the penicillins, these are the groups of the drugs are responsible for hypersensitivity, allergic reactions including skin rashes, dermatitis, urticaria, serum sickness reactions like chills, fever, edema, arthalgia, and the prostration, and plus pseudomembranous colitis are the adverse effect of the penicillin G. Contraindications should be avoided in the documented hypersensitivity with the drug, and in the pregnancy category B, safe. So these these are all about the treatment of the sexually transmitted infections.